Symposium this coming Thursday. So what in the world is a shock symposium? Here to provide that answer is Dr. Jason Gluck, System Medical Director for Mechanical Circulatory Support at Hartford Healthcare. Doctor, welcome.
Thanks for having me.
Great to have you. So talk to us about the Hartford Healthcare Shock Symposium. What exactly is this event?
So the sickest of the sick patients are the ones that get admitted to an ICU or an intensive care unit. This symposium we started several years ago to really bring the most cutting-edge technology to these patients and make sure people are treated with the highest level of care. So this symposium is an international getting together of people from around the world on how is the best way to treat these sickest of the sick patients.
All right, doctor, who is this event specifically for and how do they benefit?
So it's targeted toward paramedics, advanced life support providers. It's targeted for physicians and nurse practitioners and advanced practice providers, PAs. It's also targeted toward physician medical directors and above, where we talk about how we can get them transports and heart and lung machines and transplants or whatever they need for their patients in expedited timing.
All right. And doctor, why is it important for healthcare workers to attend an event like this?
It's important because not every hospital in the world is able to take care of the sickest of the sick. And we're oftentimes dependent on transfer of care to get the highest level of care for our patients. So to ensure all patients get equitable access to care, it's important to know what's available, how to get to them, and how to best navigate the system. And this symposium focuses on exactly that.
Can you tell us a little bit more about the training?
The training this year is very exciting. It's the first ever in the world outdoor healthcare symposium. We chose it to be outdoors because of the COVID pandemic and to make sure our providers are safe. We're also going to be having a couple of helicopters come in this year, including the Air National Guard and their Blackhawks, so we can train on how to move patients as well on the actual equipment we use and bring in expertise for simulation and for lecture training all in one venue.
And doctor, you say the sickest of the sick. Tell us about this. What kind of support are these patients on?
So these are oftentimes patients that require artificial organs, artificial heart and lungs, artificial kidneys, and machines to help them going, the ventilators, and also times when those aren't enough. So sometimes when the ventilator's not enough, for example, in COVID, when the person can't breathe despite a ventilator, they sometimes need an artificial heart or lung, like an ECMO machine, to help them. And this will focus on how to get that there to them.
All right, Hartford Healthcare's Dr. Jason Gluck, thank you so much for this information. It sounds like wonderful training.
Thank you very much for having me.
Thank you.